Hello, class, and welcome to week 3. We're moving right along. I enjoyed reading everybody's Pico element questions that were submitted for the week 2 threaded discussion. We took some time to get those tweaked out, and that's real important to make sure you've got those solid bases for building the rest of your milestones. I will be working on your milestone 1 grades to get them back to you as soon as possible. While you don't have any milestones due this week, you do need to start working on your milestone 4 because it is a big, or your milestone 2 that's due in week 4 because it is a big project. This week's course outcomes are to communicate effectively with patient populations and other healthcare providers in managing the healthcare of individuals, families, aggregates, and communities. You have 2 threaded discussions that are due this week. The first one is decision-making process. So we're going to look at a decision that requires nursing judgment that you make, probably in your job or in a nursing school situation, and describe the process for decision-making and problem solving that you used for that particular problem. The next one is communication errors. Boy, do we know that this can be a problem in the workforce. So we're going to describe a situation that there was a communication error or an error that occurred and describe how poor communication played a part in that. And what was the cause of the communication error, and what are the possible solutions to the problem? So these are very important concepts, and usually these are very eye-opening when we look at errors that occur in healthcare today. So let's talk a little bit about milestone number 2 that is going to be due at the end of week 4. So it's not due this week, but please start working on it. It will be due the end of next week. So let's take a look at those particular documents. In doc sharing, you will see that there are two documents for you that you will need to look at. The first one is the guidelines and the template. So let's look at the guidelines first. This assignment is worth 225 points, so it's worth a pretty large chunk. And again, it's due at the end of week 4, but you should start working on this now. Here are some of the directions about the assignment. The assignment, let me look, about 4 to 6 pages long, and it is going to be an APA format. Here's the grading criteria and where the majority of your points will be given when you are answering steps 1 through 10 here. And then here is a greater detail. Obviously, when you're looking at the grading rubrics, you want to make sure that you've identified and you've addressed all the elements that are in this first column. This is where you get the majority of your points. You want to make sure that each one of these things are addressed thoroughly in order to be able to get the maximum points for this assignment. So there is a template in your doc sharing, and I want to make sure that you use this template, as this will help you tremendously in making sure you have all the information. What you'll want to do is when you get it, you will go in and you will do save as, and you will save it to whatever you want to save it in, but make sure that you save it with your last name on it, and just as long as your last name's on it, that should be fine. And then what you are going to do is you're going to make the changes. So here you will, put your title here, your name, your term, and year. So this will be November 2014. You'll need to click onto the running head, and I want you to put your running head here, which is a shortened version of your title, and that should be in all caps. And then again, you'll come down here and you'll put your title here, and then you'll need to change this as well because the first page is different than the remaining pages for the headers. So then what you need to do is you're going to take out this this information, but this part will tell you a brief description of what needs to be in here. So right here you need to talk about the problem, just give you a very quick overview of why this is a problem, and why you chose this topic. Remember that you should not be writing in first person. You should be writing in third person always, and this is a formal APA paper. So then we're going to go to the change model. Here I want you to describe to me the change model that you are using. You're obviously using Johns Hopkins Nursing Evidence-Based Practice Model. Tell me a little bit about that model and why it is a good model to use for change. And then, so this will be a good overview here. Now here you're going to go into each one of your steps. So this first one, your first level heading is the practice question. You do not have to change the level headings. This is appropriate. All of these are done. So do not change these. Again, you will just highlight this, and then you will start backspace, and then you will start writing your information that's in here. So on step one, you're going to restate your question. Do not list your PICO elements like you did in your threaded discussion. Instead, what I want you to do is I want you to write them in paragraph form. The problem that I seen, or not I, can't say I. So the problem is that there are increased urinary tract infections on the post-op care unit. The intervention that will be applied will be that there will be a protocol that will monitor the days that the catheter is in, and it'll be a nurse-driven decision on when to take the catheter out. The comparison would be the current practice, which is that that physician's orders are needed before the catheter can remove, and the outcome that will be identified will be that we will, not we, because you can't use first person, the outcome will be that there will be a decreased incidence of urinary tract infections on whatever particular unit you are. So that's kind of what that should look like. Again, remember that it's in paragraph form. I want you to give me all those PICO elements. I don't want you to list them like you did in the milestone 1 or in your threaded discussion post. Okay, moving on to the scope of the problem, our scope of the question. So why do we care? Like, why do we care that we have more urinary tract infections? Here, I want you to give me some statistics. Give me some hardcore stuff. We care because the cost of caring for a patient with a UTI in the hospital setting is X amount of dollars. Find some research on that. Talk about the fact that it's certain providers are not paying for hospital-acquired infections, and so financially it's a huge burden. Again, give me the information. Talk about death rate from urinary tract infections and sepsis that occurs. So tell me the meat of the problem. Why is that? Why do we care? So now for step 3, 4, and 5, we're going to be looking at the team. You will be the leader of the team because you are the person who's in charge of this project. But you also need to include, who else will you include? So if you're doing a project on catheter-induced infections, it seems to me like the relevant stakeholders in there would be all nursing care, it would be your nursing assistants, it would be nursing management, maybe it'd be infectious disease nurse, it will be the physician caring for the patient, and it'll be the patient itself. So who do you need to bring on board? This will obviously depend on what your project is. You really don't need to have more than 8 members. You could list 100. Obviously, I don't want them by their names. I want you to just give them the title, the theoretical names that it would be. So, for instance, like the infectious disease nurse, not, my friend Kathy, who's the ID nurse. So, and why did you choose them? Again, depends on your question, why you would choose them. Okay, so now go into steps 6 and 7, the internal and external search for evidence. So here is where you're going to talk about the type of evidence you found. Where did you use all peer review articles? Did you use evidence-based guidelines, quality improvement data, position statements, quantitative, qualitative research? What is it, the kind of research that you used? Briefly discuss how the strength of this research based on what you did on your milestone number 1. Then you're going to go to the synthesis or the summary of the evidence, and this is 8 or 9. Now this is a really big chunk of information, so please don't give me a paragraph on this particular section. So here I want you to talk about use the 4 sources. You can use additional, and I want you to tell me what you found. What I don't want you to do is give me 4 paragraphs and said, this research from this source stated this, and then the next paragraph you talk about the next source. I want you to tell me the themes. So I want you to organize this in themes. like for instance, if you're using the same project that we talked about before with urinary tract infections, one of your first themes might be prevention of urinary tract infections. So what did your articles talk about were effective uses of prevention? And then, your next paragraph would be something different. Maybe it's a different prevention. Maybe the third paragraph is what didn't work or what the current standards are based on things. So if you can understand the difference between having a paragraph for each article versus separating it into themes that you saw throughout all of your research. And then step number 10 is recommendation for change. So based on your research, what did the research recommend? Did it recommend pulling catheters early? Did it recommend certain cleaning procedures? What is it that was recommended in the research that you that shows that there's evidence that you might want to implement this on your unit? Okay, so then we're going to go into translation. So here is the action plan. You do not have to implement your project for this course. Obviously, it's only an 8-week course, so you're not going to be able to do this. So this will be kind of futuristic. What would you do? So, but I need specific steps on what you would do for your pilot study. What is the timeline? Make sure that you include a plan for evaluation and outcomes and the methods to report your results. So this is a pretty big chunk as well. So I should be able to take another nurse or myself should be able to pick this up and really understand how you plan to implement this. Step by step, what will you do? You will meet with the nurses. You will give them the information. How will you track it? You will have audits of the patient's charts to make sure that protocols are being followed. You will collect the data for the 30 days, whatever your time frame is. You will look at the data. You will compare it to your urinary tract infections from the previous month. So I really should have a good idea kind of what your plan is by reading this steps 11, 12, and 13. Now as we move to step 14 and 15, evaluating your outcome. So tell me what's your desired outcome. In this case, it's going to be a decreased urinary tract infections. How will you measure them? Will you measure them? Will you follow them up for 30 days post-discharge? Will it only be while patients are inpatient? Will they be measured? Obviously you would be measured by a UA and culture and sensitivity. And then how will you report the results back to the key stakeholders and to your staff? So there will be a meeting to discuss the results. It will be included in the infectious disease newsletter. Tell me how you're going to let everybody know what your results were. And it's very important that that we communicate these not only to internally but externally. So steps 16, 17, 18 is implementation. So now that you've proven, we're going to assume that you've proven that your intervention was effective, how will you implement it on a larger scale? Or how will you make it permanent changes? So for instance, if you just did this on your unit, then how would we make it a hospital-wide policy? Well, we need to change the policies and procedures. We need to educate the staff on all the other floors about the changes. We need to educate the physicians about the change and how that will happen. Obviously this will all depend based on your particular project. So how will you will ensure that the implementation is permanent? Well, you're going to change the policies and procedures. You're going to have follow-up every 3 months. You will have random audit charts. Those are the type of things I'm looking for. And how will you communicate your findings internally? We talked a little bit about this in the step 14 and 15, by meetings, memos, in newsletters, and then also how will you externally disseminate this information? So can this information be used outside of your organization? This is very important because if every hospital is doing their own little studies and nobody publishes that information, we can't learn as a body and we can't be effective as a body of nursing and as a discipline to be able to further evidence-based. If people are doing great research, we need to publish that so that others don't have to do the same research over and over, but they can use those findings so that they can apply those to their facility as well. And then we're going to go to the conclusion, and in this conclusion, you should review the key aspects of the problem and discuss the change model. Make sure you discuss the change model briefly in your conclusion. It's your whole paper's based on it, so to not have it in the conclusion would be not a good review and conclusion of your entire paper. And then review the important aspects of that. Again, no new information should be put into the conclusion, but again, this should be, if somebody quickly read just your conclusion, they should have a good idea what your paper was about. Again, here's your references, then you will type your references. Make sure you include your hanging indents. For every reference you have, you must have in-text references within the paper as well. I do recommend that you use smart thinking, and if you go to your course homepage and you go to Tutor Source, and you go to here to Smart Thinking, you will be able to see, and then you got to go here too, you will be able to submit your information there. This is fabulous resource for you. They do not grade your paper, but they do give you good feedback about grammar, content, and stuff. So you really want to make sure that you do this. I will tell you that most of the time students say that it takes about 24 to 48 hours. If you submit it on a Friday, it usually will take a little bit longer. So you want to make sure you work ahead and give yourself time to be able to use this. This is a paper that will be turned in to turn it in. So when you go to your Dropbox, mine is going to look a little bit different than yours. You will upload it, and then when you come back to it, you will actually see a percentage, which is a similarity index. Anything above 24% will not be graded. You must make sure this is your own work. I have been known as the plagiarism queen, because if you plagiarize, I promise you, I will look it. I will look for it. So it is very, very important that you do not plagiarize. This is your last class, and I have to tell you, I have had students who were expelled from the program on their last class for plagiarism. Now, I don't say that to scare you. I say that just because this is a huge deal and this is an integrity issue. So do not plagiarize. Do not borrow somebody else's paper and just make a few changes. This must be your own work, and you must cite and reference properly. Now, if you're not sure how to cite and reference properly, please come and see me. Again, people don't get expelled for referencing incorrectly. They get expelled for borrowing somebody else's paper. So I want to clarify that. But it is a big deal, and even unintentional plagiarism is considered plagiarism, and you are responsible for knowing the difference. So again, once you submit your paper, you need to go back and look at the Turnitin similarity index to make sure that it is in an appropriate range. There is in Doc Sharing, under Turnitin, there is a complete explanation of the Turnitin plagiarisms and stuff. So these are the 4 that you will have in yours. They'll talk about the report flow sheet stuff. So take a look at this, because this is a very important information that you will need to look at. So again, I hope everybody has a fabulous week. I'll look forward to getting your Milestones 1 graded. Start working on Milestone 2. If you need anything at all, give me a call or email me. And like I said, have a great week, and I look forward to learning some more in week 3.